Good morning, everyone. I hope you all are doing well. So, the topic that we are going to study today is ischemic heart disease, and in IHT, हम पढ़ेंगे MI. Okay, so let's just start off. Now, ischemic heart disease. Ischemic heart disease, it's not a single disease. These are a group of related entities which are resulting from myocardial ischemia. ठीक है, इस्कीमिया क्या होता है? आपके हार्ट में ब्लड नहीं जा रहा है प्रॉपरली. ठीक है, रीजंस हम पढ़ेंगे रिजल्टिंग फ्रॉम मायोकार्डियल इस्कीमिया ड्यू टू इम्बैलेंस. ठीक है, देयर इज एन इम्बैलेंस बिटवीन द डिमांड ज़्यादा हो गई आपकी बॉडी की बिकॉज ऑफ एक्सरसाइज और एनी अदर फिजियोलॉजिकल कॉजेज और पैथोलॉजिकल कॉजेज ऑफ इंक्रीज डिमांड, और द सप्लाई इज कॉम्प्रोमाइज्ड. मे बी देयर इज अ कंजेनाइटल वाल्वुलर डिजीज और एनी other pathological conditions जिसमें the heart is not pumping sufficient amount of blood to the tissues. अब इसके consequences क्या होते हैं? The consequences of IHD are there's angina. You have studied angina. There are two kinds of angina. You have stable angina and you have unstable angina. Or number 2, there may be MI, जो हम डिटेल में अभी पढ़ेंगे, or there may be chronic IHD, chronic ischemic heart disease, or there may be sudden cardiac death. So these are the 4 consequences जो आपके ischemic heart disease की वजह से होते हैं. So the one that we are going to study in detail today is MI. So myocardial infarction, right? Let me write it a bit more clearly. MI, commonly referred to as heart attack. So ये MI, heart attack, what is it? Before we start off with the pathology and the etiology, what is it? A common overview. MI or heart attack, it's myocyte necrosis. What has happened? Your myocytes have undergone necrosis. Now the question is why? इनमें necrosis क्यों हुई है? इनमें necrosis हुई है because of myocardial ischemia. That's the reason for your myocyte necrosis, ischemia. Now, all right, हमने देख लिया myocyte necrosis because of myocardial ischemia. But what is the crux? If the examiner asks you in the viva, हो क्या रहा है? What is the basic thing that's happening? The basic thing is that because of this myocardial ischemia, when it gets prolonged, when your myocardial ischemia, when it gets, oh my god, when it gets prolonged, so no nutrients are supplied, and the other thing is no waste is removed. So these two things lead to myocardial ischemia and henceforth myocyte necrosis. Now let's dive into the etiology. Now, the most common cause for this myocardial ischemia is atherosclerosis. And this atherosclerosis is directly proportional to age. So, as the age of the person increases, there's more risk of atherosclerosis. And also, as the age increases, there's more exposure to the atherogenic risk factors. And now elaborating upon the age factor, middle age may, this is very important for your PG examination as well. If they have asked you middle age, right? Middle age may, it's more common in men than in women, but in postmenopausal women, it's more common in women than in men. Why? Because of decreased estrogen. MI. And the pathogenesis of MI, let me take another pen. Yeah. So this is your normal coronary artery, right? You know the layers? This one is your adventitia. This one is your tunica media. This one is your tunica intima. So what happens is that there's atherosclerosis. We've just done this in etiology, that there's atherosclerosis of the coronary artery, right? So this is your plaque which has formed. You can see what is this. This is your plaque, atheromatous plaque. These right here are your cholesterol crystals. What happens next is, what do we see? We see acute plaque changes. And what are those? We'll study them in detail. So this is your plaque. Alright. These are your plaque. So these are your cholesterol crystals. So what happens is that, there's either your plaque may either rupture, or there may be fissuring, or there may be ulceration of the plaque. All of these changes, what they lead to? They lead to platelet addition, aggregation, and disruption of plaque. So this is going to look like somewhat similar to these are your platelets which are just aggregating, and this leads to formation of an occlusive thrombus. Alright, you have the plaque contents. You can see that there's this thrombus which has formed over the plaque. So there's formation of occlusive thrombus. Now let's elaborate a bit on the acute plaque changes. We just did acute plaque changes. What happens whenever there are acute plaque changes, which may be two? Alright, the first changes that we are going to discuss, there may be erosion, or there may be ulceration, or rupture, or fissuring of the plaque. All of these lead to exposure of highly thrombogenic plaque, right? So what will happen? There'll be sudden plaque, there'll be sudden there'll be sudden thrombus formation, and we all know that there'll be occlusion, and that occlusion will lead to ischemia and necrosis, which is death of the tissue. The other point that we are going to study is, in acute plaque changes, one, you have the erosion or ulceration or rupturing or fissuring. The other change that you have, there may be hemorrhage. ठीक है, क्या हो सकता है? Hemorrhage हो सकता है into the central core of the plaque. Whenever there's hemorrhage into the central core of the plaque, that is going to increase the size of your plaque. Alright, the size increases. So because of that increase in size, there will be sudden occlusion, and that sudden occlusion will lead to again your ischemia plus necrosis. Robbins, that in around 10% of the patients, we have some other causes. So in about 10% of the patient, those other causes may be grouped into 3. There may be vasospasm, or emboli, or certain uncommon conditions like because of vasculitis, because of sickle cell. This is your artery, your vessel, sickle cell has occluded it, or because of shock. Now when we talk about vasospasm, what has led to vasospasm? Now this vasospasm may be because of platelet aggregation, or there are certain drugs which have led to this vasospasm. The first drug that they may ask you is cocaine, and the other drug is ephedrine. So these are the etiological causes and the pathology which leads to MI. Now, once we are done with the etiology and we are done with the pathology, now let's just look. अच्छा, ये सब तो हो गया. अब myocardial response क्या होगा? Right? Myocardial response. So the myocardial response is going to be, there'll be aerobic metabolism cessation, and this aerobic metabolism cessation is going to occur within seconds. Always remember this, that this is going to occur within seconds. Now you need to